There we go. Sorry about that, guys. I will reshare if it will allow me. Yep. Okay. Can you see that now? Great, excellent. Okay, so so my talk's going to focus on a series of projects we did looking at communication with UK Bengalis, and particularly from the perspective of the oral language, Sylheti, which is shared by many people in the community. And this, the fact that the ways in which some of the people in our study were talking about COVID and experiencing COVID were very, and expressing those ideas about COVID were very different from the language of messaging. We also are going to talk about what we've been referring to as mediators, and this really speaks a bit more to what Jamir was saying about the meso level in the community being very important, and also Georg touched upon the notion of social brokering as well. I think that all sort of falls within the remit of what we are calling mediators. So the project, it's a qualitative project. We focused on community elders because, based on our previous work, we realized they were most likely to be the people who had access issues. We then asked them to nominate people in their wider or immediate social network who they relied on to access information that they couldn't access themselves. And not all of them did. Some of the elders we interviewed were very independent information seekers, had no problems accessing information, but a lot of them did. And so we also interviewed these information sharers, who are usually people in their family members or people in a slightly wider support network, neighbors or acquaintances, who were helping them out with information. And we were trying to understand the sort of beliefs and practices that had been adopted, and specifically how these had been influenced by access of information and capacity to access information. And these insights helped us develop and ideas about how to engage the community with information about COVID, and this led to the production of an animated film called The Corona Story. You've seen a still from that on the first slide, and I'll talk a little bit about that at the end. In addition, we wanted to sort of draw upon these findings to improve what we could see as an apparent shortfall in communication with the community and culturally and linguistically tailored communication. And so we started a project called Corona Awareness, and this drew upon this idea of mediation that we were using as part of our, that was coming out of the study. And I'll talk a little bit about the different initiatives and how they drew upon the project ideas at the end as well. So I'll start just by outlining some of the key findings that they pertain to the topic of today's session. So what immediately stood out is that because the interviews we were conducting with the older participants were in Sylheti, that was for many of them their primary language and only language that they used to access health information. And so that it was noticeable that none of the concepts that were becoming the bread and butter of discourse about COVID were included in their language. And this is because, as an oral language, Sylheti does not have a technical register. It doesn't have medical terms, words for social distancing, droplet symptoms, and high risk. These are all concepts that need to be imported. Instead, what we found when we looked at the interviews, so for instance, we looked at metaphoric language. So the metaphors that the older participants used in Sylheti were highly visceral and based around situations, very different type, not so much an abstraction, but more of a tying down to something that their embodied experience or their immediate experience in the community. So for instance, transmission was touching somebody's breath. So somebody was infected, their breath was almost like an object. If you touch it, that's how you get it. No mention of transmission vectors and such things. The virus was portrayed sometimes as a predator, of having an animacy, tries to seek you out, destroys you, looks for your weak spot, and lockdown was all about going into hiding from the predator. Or comparison to something quite familiar, the virus as wind, batash, a wind that came through the community. in addition to that, we also they also tended to rely on narrative framings for things like vulnerability. So, for instance, one of our participants talked about a neighbor he had back home in Bangladesh who got a cough, and then he had body pain, had to go to the hospital, and fell ill and unfortunately died. And the point he was making with his story was that he was vulnerable because the neighbor was 10 years his junior. So we have these situation-based and storied framings that are actually quite in line with what we know about how oral cultural societies, although I'm not suggesting that Bangladeshi community is an oral cultural society, but it's certainly in line with observations about orality and how that relates to how new and emerging issues are engaged with in these more concrete and narrative frames. So if we, the another thing that comes out of the interviews with the older participants is that that there was a strong preference for understanding and learning about things face to face, orally. And we see this for this example here. This participant, when they went for dialysis, talked with other ladies she knew about the virus, and that's how she was keeping herself informed. But we have to remember, the project was conducted in the early phases of the pandemic where lockdowns were often in effect. And these opportunities for social contact, casual social contact like this, were limited. She could only go to dialysis and meet these people because she had dialysis. Far more common in our data was that they were the older participants were completely reliant on the information sharers. So if anything happens, then my son and his wife message me to say to do this or not to do that. And this is hardly new. This is, as also comes out of the data, a cultural practice. We now have our children to interpret for us. This is something that happens anyway, but the function of these networks was restricted, as we can see with that first example. And this idea that the information sharers were fulfilling a social role is also confirmed by the way they talked about their agency, considerable agency, not just as in terms of accessing information, but as information seekers and sharers. And this contrasted really with the older participants, because who really had often no other opportunity to engage with information because they couldn't access it or in a way that made sense to them in English or in a written form. So so they could only, for instance, ask them to show me videos. And so, of course, then if it comes to negotiating trust in new measures and in risk mitigation and things like the vaccine, trust needed to be built very locally. And by locally, for the older participants, it's meant very, very locally. They talked about they clearly trusted their information sharing relatives. My daughter will tell me anything is good. And this was the viewpoint of the pandemic that they relied on and built on. When they talked about the government or the state, it was always quite distant. It always felt quite distant. So for instance, we have this metaphor here of power as food. The government feeds us because Allah feeds it. The government is really situated here within the wider framing of the religious beliefs. It was something that was far away. Instead, they talked to the people who were there and present and oral. In contrast, the information sharers had a very multi-layered understanding of the pandemic, and they seem to understand the state's location within it. And I suppose Jorg's presentation made me reflect on a few things. I mean, it seemed to be mostly at the level of trust that seemed to be causing them issues was the fact that the current leadership was seen as complicit in creating the inequalities that created the greater vulnerability of the community they were within. And as such, we really began to see an axis of trust moving from national to local, where more local sources were more trusted. A lot of information sharers that they turned away from government updates and went to things that were more available for them. So things like on-the-job training. Some of them were pharmacists or community workers, and they'd had some sort of on-the-job training about how to risk mitigate, and that was their go-to. At the same time, just thinking about what Shamir was saying about trust in experts, that was also, it comes out of our data that was actually quite strong across our sample. Older participants trusted their GPs. The information sharers often talked about ignoring a government advice and going to the WHO website because it was a health website. So I suppose the case from this is that the most trusted messengers of advice would be local health experts. So what does this mean then, I suppose, in terms of mediation, and so in terms of the informational systems that were happening there? So clearly there is an oral informational ecology there, and what's happening is there's a written informational system trying to engage an oral one, and people, the information sharers in this case, are having to step in as linguistic and cultural mediators. They're reframing understandings from written communication into the oral, into ways that are resonant for people who speak an oral language. That's quite a juggling act. They're operating at this meso level. I suppose the meso level in our study has got two layers. Firstly, we have this meso level between individual and community. They're helping individuals shape their behavior by learning from their community and giving and sharing knowledge. And we see this because despite the asymmetrical access in our sample, there were similar assumptions and beliefs about the risks of the virus and an awareness of key messages. But this role that they were playing as sort of has them operating as linguistic gatekeepers. There's a linearity to the flow of information. It's not, so if they get the wrong idea about something, then it's likely that the older participants will get the wrong idea. So that's also shown by the fact that in our data, there are similar confusions across the sample. For instance, this idea of support or social bubble was quite an abstract message really about which allowed two households to freely mix during lockdowns as a sort of social support. That didn't make much sense to a lot of the social contexts, partly relating to a more expansive conceptualization of household. Household wasn't just the people you lived with, but the people who had lived with and people who lived locally or extended family, and it wasn't tied to a geographic space. And unsurprisingly, interpretations of social bubble within our older participant sample were also quite, either it was not understood or they interpreted it in ways that were potentially quite risky. So this idea that in your social bubble you don't get sick. In fact, of course, close relations are most likely to pass COVID on to you. So just to wind things up, what we wanted to do with our outreach work was to try and focus then on what we felt was perhaps a missing level in this, the missing aspect of this meso level between state and the people in the state, by trying to boost the oral information ecology by working on initiatives that promoted mediation at a community and state level, so an interaction between community and state. And this is not something new, this is something that was happening anyway. We're going to hear from community activists who were doing this, stepping out of their day jobs, as it were, to inform and share information about the pandemic, to fill this gap in orally and culturally framed messaging. So what all our initiatives sort of revolves around this idea of community versus state and community mediation. So we recruited mediators. The idea is then the mediators, in a sort of snowball effect, educate people in their community who then activate other family members and neighbors, spreading the word, developing the oral informational ecology, and redressing the inequality in terms of how messaging was being communicated. Three initiatives that we used. So the first one involved the animated film. The film itself, it basically tells a story of one family's experience through the pandemic, and that family represents the community's experience. And the hero of the film is a young pharmacist called Shaila, who intervenes as a mediator to reduce the risk for a family. So and as well as sort of providing a housing for some of what we were learning from the study and messages about risk reduction that were culturally framed, we also wanted to raise critical consciousness of mediation as an important function of the oral informational ecology. The second initiative we used involved promoting local doctors as mediators. So we knew that doctors would probably be trusted messengers, and here we expanded our work to include doctors working in other communities, so speakers of Pahari and Pashto, as well as Sylheti. And these created, because there were videos, they were orally shareable and accessible. And at the same time, I suppose the third initiative is something that Shamir was talking about in terms of COVID champions. So we trained up mediators in a collaboration with the Asian Resource Centre Croydon. the idea of that initiative is that the mediators then, much as with the community champions, go out and represent this interaction between state and the community, build the information ecology, provide multiple access points for people who are previously only able to access information through their trusted family members. So I think that is where I'd like to leave it. That's right on time, I can see as well. I'll put these links in the chat once I hand over to Shyla. So I'll stop sharing for now. Right.